Depression is a common but serious disorder that affects the mood of humans. The person tends to feel sad, hopeless, anxious or angry, often without apparent reason. Few of the symptoms of depression are a loss of energy, a change in appetite. One may feel very hungry or not feel hungry, sleeping more or less, anxiety, reduced concentration, indecisiveness, restlessness, feelings of worthlessness, guilt, and thoughts of self-harm or suicide.
Depression can have adverse consequences. It can have an impact on your health. It can worsen your blood pressure. It can increase your diabetic status. It can also mean an increased risk of heart attacks. It can also lower your immunity against infections. It can also have adverse economic consequences due to months and years of lost productive life in the time spent in the depression. But worst of all, depression can lead to death by suicide. It is wrong to think that a person who is depressed and is talking about suicide is not going to do it. Figures show that people with depression have a 20 times higher risk of committing suicide than patients with any other illness.
Girls in the age group of 15 to 24 years are going through a critical phase in their life with physical, physiological and behavioral changes. So mood swings are common. However, 1 in 4 to 5 girls will be diagnosed with common mental issues like depression and anxiety. And this is just the tip of the iceberg. Symptoms are non-specific. It could just be poor school performance, social withdrawal, or difficulty in sleeping or eating. So help comes first in the form of family, friends, and of course doctors and therapists. Listening to them with empathy and understanding is the first step. Anxiety and depression in this age group is curable.
Depression is a sort of a smoldering fire affecting all the systems of the human body, and the patient comes to us with varied symptoms, and we use the word psychosomatic. The quality of life of the patient is adversely affected. As a senior consultant medicine, I happen to be the first point of contact. It's my responsibility to recommend appropriate medications. But as a musician and a music therapist, I would also recommend music as a supplementary medicine because it resets the neurohormonal imbalance which is being created, and mind you, it doesn't have any side effects.
Depression is a common condition and is treated completely. Depression can be treated by talking treatments such as psychotherapies of cognitive behavior nature or interpersonal nature or various techniques. And apart from psychotherapy, sometimes when depression reaches severe forms, one might need medication. There is a huge stigma about getting treated for depression. People tend to push it under the carpet and not bother about the existence of depression till it takes severe form. We urge you to talk about depression when you are going through signs and symptoms of depression, such as being withdrawn or feeling sad, or any of your near and dear are going through. I think we should talk about it. There is this constant fear that talking about depression makes it worse. In fact, it actually makes it better. So let's all talk about depression and let's defeat depression together.